Question 1. A social worker meets with a client who reports experiencing significant weight gain, lethargy, and an increase in blood sugar and cholesterol since starting a new psychiatric medication 6 months ago. The client is most likely taking which class of medication?
A.
Selective serotonin reuptake inhibitors, SSRIs.
B.
Typical antipsychotics.
C.
Mood stabilizers such as lithium.
D.
Atypical, second-generation, antipsychotics. Answer: D. Atypical, second-generation, antipsychotics. This question tests knowledge of common and serious side effects, specifically the metabolic risks associated with atypical antipsychotics. The keywords are weight gain, lethargy, increase in blood sugar, and cholesterol, which together describe metabolic syndrome, a major concern with medications like olanzapine or risperidone. These medications, which treat conditions like schizophrenia and bipolar disorder, carry a high risk of metabolic changes that can lead to diabetes and heart disease, making it crucial for social workers to monitor and refer. A helpful takeaway tip is to remember that atypical antipsychotics are generally the class with the highest risk for severe metabolic side effects. Question 2. A client being treated for bipolar I disorder has been prescribed lithium. The social worker's primary ethical responsibility regarding this medication is to ensure the client understands the necessity of
A.
avoiding all foods containing tyramine, such as aged cheeses and cured meats. B. Maintaining regular blood tests to check for drug toxicity and therapeutic levels.
C.
Taking the medication only on an as-needed basis for acute episodes of mania. D. Switching to a new medication immediately if any sexual side effects are experienced. Answer: B. Maintaining regular blood tests to check for drug toxicity and therapeutic levels. This item assesses the social worker's ethical responsibility to ensure informed consent and client safety regarding high-risk medications, with lithium and primary ethical responsibility as key clues. Lithium has a narrow therapeutic window, meaning the effective dose is very close to the toxic dose, necessitating routine blood work to prevent potentially fatal toxicity. The social worker must emphasize that blood level monitoring is non-negotiable for safe and effective treatment with this specific mood stabilizer. For example, a client who is severely dehydrated may experience a rapid increase in blood lithium levels, and regular blood tests are the only way to detect this danger. Here's an easy way to remember. Lithium equals level checks, which is the social worker's primary educational duty for this drug. Question 3. A client diagnosed with generalized anxiety disorder, GAD, reports chronic tension and worry. The social worker knows that as a non-addictive, non-sedating alternative to benzodiazepines, the psychiatrist is most likely to prescribe
A.
lorazepam, Ativan.
B.
Buspirone Buspir.
C.
Sertraline Zoloft.
D.
Haloperidol, Haldol. Answer: B. Buspirone Buspir. This question tests the recognition of a specific anxiolytic medication often used as a preferred alternative to habit-forming options, with the clue being the need for a non-addictive, non-sedating alternative. Buspirone Buspir is an anxiolytic that works differently from the sedative hypnotic benzodiazepines, making it a safer long-term choice for anxiety, without the risk of dependence. While SSRIs like sertraline are common first-line treatments for GAD, buspirone is the specific non-addictive option often chosen to avoid the dependence risks associated with lorazepam. A good takeaway tip is to associate buspirone with the term non-addictive anxiolytic, in contrast to the highly addictive benzodiazepines. Question 4. A client reports taking an antidepressant that has significantly helped their depression but has also caused dry mouth, blurred vision, constipation, and urinary retention. This symptom profile is characteristic of which older class of medication?
A.
Selective serotonin reuptake inhibitors, SSRIs.
B.
Monoamine oxidase inhibitors, MAOIs.
C.
Tricyclic antidepressants, TCAs.
D.
Serotonin norepinephrine reuptake inhibitors, SNRIs. Answer: C. Tricyclic antidepressants, TCAs. This question evaluates the recognition of anticholinergic side effects associated with older antidepressant drugs, with dry mouth, blurred vision, constipation, and urinary retention being the critical symptom clues. Tricyclic antidepressants, TCAs, such as amitriptyline, are known for strong anticholinergic properties due to their nonspecific effects on receptors in the body, which cause these uncomfortable side effects. Though rarely used as first-line treatment today, they are essential to know because clients may still take them for depression, anxiety, or chronic pain. The social worker should remember that these multiple systemic symptoms are a clear sign that a client is likely taking a TCA. Question 5. A client with major depressive disorder, MD, is prescribed fluoxetine prozosine. The social worker's most important next action should be to
A.
Immediately contact the prescribing physician to suggest a more effective medication.
B.
Educate the client that the full therapeutic effects will be felt within 3 days of starting the medication.
C.
Assess for signs of suicidal ideation and create a safety plan, especially during the first few weeks of treatment.
D.
Advise the client to abruptly stop taking the medication if they experience minor side effects like mild headache. Answer: C. Assess for signs of suicidal ideation and create a safety plan, especially during the first few weeks of treatment. This is a most important next safety-focused question, testing the social worker's understanding of the black box warning for SSRIs like fluoxetine in MDD treatment. The critical concept is that in the initial weeks of treatment, as the medication begins to increase energy before fully lifting mood, the client may have a higher risk of acting on suicidal thoughts. Therefore, the most important immediate action is always to prioritize client safety, including assessing for suicidal ideation and safety planning, regardless of the client's current presentation. The social worker's ethical obligation is to monitor the client closely until a therapeutic response is achieved. Question 6. A social worker receives a referral for a child with ADHD who is taking methylphenidate, Ritalin. The social worker should routinely check in with the parents and school about which common side effect?
A.
Increased appetite and rapid weight gain.
B.
Development of tics or involuntary movements.
C.
Trouble falling or staying asleep and decreased appetite.
D.
Sedation and difficulty concentrating. Answer: C. Trouble falling or staying asleep and decreased appetite. This question tests knowledge of the common stimulant side effects in the treatment of attention deficit/hyperactivity disorder, ADD, with methylphenidate and common side effect as the key clues. As a central nervous system stimulant, this medication frequently causes insomnia, trouble sleeping and anorexia, decreased appetite, which can lead to poor nutritional intake or weight loss. The social worker's role is to track these symptoms in consultation with the parents and prescriber to ensure the benefits of treatment outweigh these developmental risks. Parents might, for instance, be advised to offer a high-calorie breakfast before the dose and a nutrient-dense dinner after the drug's effects wear off. Question 7. A client with schizophrenia abruptly stops taking their prescribed haloperidol, Haldol, a typical antipsychotic, and develops muscle rigidity, fever, and altered mental status. The social worker recognizes this constellation of symptoms as an urgent medical emergency known as
A.
tardive dyskinesia, T.
B.
serotonin syndrome,
C.
neuroleptic malignant syndrome, and
D.
akathisia. Answer: C. Neuroleptic malignant syndrome, NS. This question is a critical safety assessment item testing the recognition of a rare, life-threatening reaction to antipsychotic medication, specifically highlighted by the terms typical antipsychotic, muscle rigidity, fever, and altered mental status. Neuroleptic malignant syndrome, S, is a medical emergency characterized by the severe symptoms mentioned, demanding immediate medical attention and discontinuation of the antipsychotic. Though less common with newer drugs, the social worker must know these signs and instruct the client and family to seek emergency care, as NMS is a potentially fatal condition. Remember that high fever plus rigid muscles in a client taking an antipsychotic equals NMS and an immediate emergency room visit. Question 8. A client asks their social worker to interpret their latest blood test results, which show their level of a recently prescribed mood stabilizer is slightly below the therapeutic range. The social worker's best response is to
A.
explain that the drug is not working and suggest they stop taking it immediately.
B.
Review the results and then recommend a slight dose increase for the next 2 weeks.
C.
Advise the client to contact their prescribing physician immediately to discuss the results.
D.
Explain the blood levels and then suggest they only take the medication when they feel symptomatic. Answer. C. Advise the client to contact their prescribing physician immediately to discuss the results. This is a critical ethical and boundary question testing the limits of a social worker's scope of practice, with interpret blood test results and recommend a slight dose increase, serving as major red flags. Social workers are not medically licensed to interpret lab results, diagnose medical conditions, or recommend changes to a client's medication dosage, even if the information seems straightforward. The best response is always to reinforce the professional boundary and refer the client back to the qualified prescriber, such as a psychiatrist or a primary care doctor, who is licensed to make dosage adjustments. The takeaway is simple. Social workers educate and support, but they never prescribe, diagnose, or adjust medication. That is the prescriber's job. Question 9. A client reports great success with their SSRI medication but expresses worry that the medication has caused a noticeable decrease in their sexual interest and ability to achieve orgasm. The social worker should first normalize this experience and then encourage the client to
A.
immediately discontinue the SSRI because sexual side effects are a sign of toxicity.
B.
Discuss alternative medications or strategies with the prescribing physician.
C.
Request a prescription for a benzodiazepine to counteract the sexual side effects.
D.
Increase the dose of the SSRI to overcome the side effect through tolerance. Answer. B. Discuss alternative medications or strategies with the prescribing physician. This question assesses the social worker's role in helping clients manage common medication side effects with SSRI, sexual interest, and decrease as the critical concepts. Sexual dysfunction is an extremely common, non-life-threatening side effect of SSRIs that often leads to non-adherence, so the social worker must normalize the concern while maintaining boundaries. The best response is to support the client in having an open dialogue with their prescriber, who can discuss options like switching to an antidepressant with a lower risk, e.g., bupropion, reducing the dose, or adding a secondary medication. It is essential to reinforce that the client should never adjust or discontinue the medication independently, as this can lead to relapse or withdrawal symptoms. Question 10. Which class of medication is generally prescribed to manage acute anxiety or panic attacks due to its rapid onset of action, despite the high risk of dependence and withdrawal?
A.
Selective serotonin reuptake inhibitors SSRIs.
B.
Benzodiazepines.
C.
Tricyclic antidepressants, TCAs.
D.
Beta blockers. Answer. B. Benzodiazepines. This question tests the recall of the primary application and associated risk of the anxiolytic drug class, specifically highlighted by the terms acute anxiety or panic attacks, rapid onset, and high risk of dependence. Benzodiazepines such as alprazolam, Xanax, or clonazepam, Klonopin, are central nervous system depressants that quickly reduce severe anxiety symptoms, but this fast action comes at the cost of potential physical dependence and severe withdrawal if stopped abruptly. The social worker should understand that while they are effective for short-term crisis management, their long-term use is usually discouraged due to the potential for abuse and physical reliance. Therefore, associate a rapid effect on anxiety with the high-risk nature of benzodiazepines. Question 11. The social worker is concerned about a client with schizophrenia who has a long history of non-adherence to oral medication. What best course of action should the social worker discuss with the client and prescribing team to improve compliance?
A.
Encourage the client to stop all medication and attempt behavioral therapy only.
B.
Advocate for the client to be switched to an immediate-release oral antipsychotic.
C.
Explore the use of long-acting injectable LAI antipsychotic medication.
D.
Recommend a higher dose, once-daily oral pill that the client can control. Answer: C. Explore the use of long-acting injectable LAI antipsychotic medication. This is a best/most effective practice question focused on medication adherence strategies for chronic mental illness, with long history of non-adherence and improved compliance being the crucial concepts. Long-acting injectable LAI antipsychotics, administered every few weeks to months, bypass the need for daily oral dosing, significantly improving adherence rates for clients with chronic thought disorders like schizophrenia. The social worker's role is to help the client understand the benefits of LAIs and facilitate communication with the prescriber, as consistent medication is the foundation for managing psychosis. A practical takeaway is to remember that for chronic non-adherence issues, LAI medications are considered the most effective pharmacological strategy. Question 12. A social worker is educating a client who has recently started a monoamine oxidase inhibitor, MAOI, antidepressant. The social worker must emphasize the critical importance of strictly avoiding foods high in
A.
cholesterol,
B.
tyramine,
C.
gluten,
D.
fructose. Answer: B. Tyramine. This question tests essential safety knowledge about a specific, older antidepressant class, with monoamine oxidase inhibitor, MAOI, being the critical clue. MAOIs, such as phenylzyme, nardole, prevent the breakdown of tyramine, an amino acid found in fermented, aged, or cured foods, like aged cheese, tap beer, and cured meats. The accumulation of tyramine can lead to a dangerous, potentially fatal hypertensive crisis, a sudden, severe spike in blood pressure, making dietary restriction mandatory. The social worker's role in providing the psychoeducation is non-negotiable for client safety, as ignoring this rule is a major health risk. Question 13. A social worker meets a 70-year-old client who is taking multiple medications prescribed by different doctors. The social worker should be most concerned about which common issue in this scenario?
A.
Lack of a comprehensive psychiatric diagnosis.
B.
Drug-induced nutrient deficiency.
C.
Polypharmacy, leading to dangerous drug-drug interactions.
D.
Increased risk of addiction to all prescribed medications. Answer: C. Polypharmacy, leading to dangerous drug-drug interactions. This most concerned question tests the social worker's awareness of the risks of polypharmacy, especially in the elderly, where 70-year-old and multiple medications prescribed by different doctors are the key clues. Polypharmacy, or the use of multiple drugs, significantly increases the risk of adverse drug reactions, dangerous drug-drug interactions, and oversedation because the body's ability to metabolize medications decreases with age. The social worker's best practice is to facilitate a complete medication reconciliation, advocating for a single prescriber or pharmacist review to prevent these serious, preventable harms. For a simple takeaway, remember that the more pills an elderly client takes, the higher the risk for a harmful interaction. Question 14. A client reports taking an antidepressant that works by blocking the reuptake of both serotonin and norepinephrine. The social worker recognizes this dual action mechanism as characteristic of which class of medication?
A.
Selective serotonin reuptake inhibitors, SSRIs.
B.
Atypical antipsychotics.
C.
Serotonin norepinephrine reuptake inhibitors, SNRIs.
D.
Stimulants. Answer: C. Serotonin norepinephrine reuptake inhibitors, SNRIs. This question assesses knowledge of psychopharmacology mechanisms of action, specifically using blocking the reuptake of both serotonin and norepinephrine as the definitive clue. Serotonin norepinephrine reuptake inhibitors, SNRIs, such as venlafaxine Effexor or duloxetine Cymbalta, offer this dual mechanism, which can be particularly useful for clients whose depression is accompanied by pain or severe fatigue. The social worker should understand that this dual action distinguishes SNRIs from the more common SSRIs, which only block serotonin reuptake. Remember that the drug name SNRI directly tells you its action. Serotonin and norepinephrine reuptake inhibitor. Question 15. A client with schizophrenia on an older, typical antipsychotic begins to exhibit uncontrollable, involuntary lip smacking, tongue protrusion, and grimacing. The social worker should immediately contact the prescriber to report signs of what serious, potentially irreversible side effect?
A.
Neuroleptic malignant syndrome. S.
B.
Serotonin syndrome.
C.
Tardive dyskinesia. T.
D.
Akathisia. Answer. C. Tardive dyskinesia. T. This question tests the recognition of a specific, serious motor side effect of older antipsychotics, with the clues being older, typical antipsychotic, and the specific involuntary movements like lip smacking, tongue protrusion, and grimacing. Tardive dyskinesia, T, is a neurological disorder caused by long-term use of dopamine blockers, resulting in these involuntary, repetitive movements, which can become permanent even after the medication is stopped. The social worker's responsibility is to monitor for and promptly report these symptoms, as early detection is crucial for reducing the risk of irreversible damage. A simple takeaway is to link typical antipsychotics with the potential for permanent, involuntary movement problems like TD. Question 16. A client taking an antipsychotic medication reports to the social worker feeling intensely restless, unable to sit still, and having a constant need to pace. The social worker should recognize this side effect as
A.
dystonia,
B.
akathisia,
C.
pseudoparkinsonism,
D.
bradykinesia. Answer. B. Akathisia. This question assesses the recognition of a common extrapyramidal side effect of antipsychotic medications, with the keywords intensely restless, unable to sit still, and constant need to pace. Akathisia is a distressing sense of inner restlessness that is often misdiagnosed as anxiety or agitation, but it is a known adverse drug reaction requiring prompt adjustment of the medication regimen. The social worker's careful observation and accurate description of this distinct symptom to the prescriber are vital, as this severe discomfort can lead to non-adherence or even self-harm. Remember that the inability to sit still and the internal sense of agitation is the hallmark of akathisia. Question 17. A social worker is educating a client about starting an antidepressant that can sometimes increase energy levels before fully lifting the depressive mood. The social worker should caution the client and family to monitor for
A.
a paradoxical sedating effect,
B.
orthostatic hypotension,
C.
increased suicidal ideation,
D.
hypertensive crisis. Answer. C. Increased suicidal ideation. This safety-focused item tests the understanding of the initial course of antidepressant treatment and the associated black box warning, using the clue that energy levels increase before fully lifting the depressive mood. In the first few weeks, the client's energy may improve, giving them the capacity to act on pre-existing suicidal thoughts that they previously lacked the energy to pursue. Therefore, the social worker must prioritize safety and closely monitor for any signs of increasing suicidal thoughts, especially in adolescents and young adults. The key takeaway is that during the early phase of antidepressant treatment, safety planning must be intensified due to the transient energy-mood imbalance. Question 18. A client has been successfully managing bipolar disorder on a medication that has a strong association with the side effects of hair loss and significant weight gain. The social worker understands the client is likely taking
A.
lamotrigine lamictal,
B.
quetiapine seroquel,
C.
valproate/devalproex, Depakote,
D.
topiramate, Topamax. Answer. C. valproate/devalproex, Depakote. This medication-specific question tests the knowledge of hallmark side effects for a common mood stabilizer, using bipolar disorder, hair loss, and significant weight gain as the definitive clues. Valproate, Depakote, is an anticonvulsant widely used as a mood stabilizer, but it is notorious for causing weight gain, tremor, and, in some clients, noticeable hair loss. While other options like quetiapine can also cause weight gain, Depakote is the one most strongly associated with both the weight gain and the specific side effect of hair loss in mood stabilization. The social worker must monitor these side effects, as they are common reasons for clients to stop taking the medication. Question 19. A social worker's client reports they suddenly ran out of their prescribed alprazolam, Xanax, and is now experiencing rebound anxiety, tremors, and severe restlessness. The social worker's first action is to
A.
Immediately contact the pharmacy to request a refill on the client's behalf.
B.
Educate the client on the dangers of dependency and suggest they discontinue the drug completely.
C.
Advise the client to seek emergency medical attention or contact their prescriber immediately.
D.
Encourage the client to wait out the symptoms, as they will subside in a few days. Answer: C. Advise the client to seek emergency medical attention or contact their prescriber immediately. This is a critical first next best emergency safety question testing the understanding of benzodiazepine withdrawal, with suddenly ran out, rebound anxiety, and tremors as the clues. Abrupt cessation of benzodiazepines like alprazolam can lead to severe and potentially life-threatening withdrawal symptoms, including seizures, necessitating immediate medical consultation or emergency care. The social worker's primary ethical and professional duty is always to ensure client safety, which means connecting them immediately with medical personnel qualified to manage the physical symptoms of withdrawal. Never attempt to handle a physical dependency crisis or recommend abrupt cessation in the office setting. Question 20. When conducting psychoeducation for a client on an SSRI, the social worker should explain that a common reason clients often stop taking their medication is
A.
The side effects are usually life-threatening.
B.
The medication causes significant joint pain and inflammation.
C.
They feel better and mistakenly believe they are cured.
D.
They develop an immediate hypertensive crisis. Answer: C. They feel better and mistakenly believe they are cured. This question assesses the social worker's practical understanding of medication adherence patterns, focusing on the common mistake clients make once their mood improves. Once a client feels better, they may mistakenly assume the underlying disorder is resolved, leading them to discontinue the medication prematurely, which significantly increases the risk of a relapse of depressive symptoms. The social worker's role is to normalize the need for continued treatment and to emphasize that feeling well is evidence the medication is working, not that it is no longer necessary. A helpful takeaway is to coach clients on the importance of maintenance therapy and to never stop a psychiatric drug without a doctor's plan. Question 21. A client with bipolar disorder who is currently stable on lamotrigine Lamictal asks the social worker what the most serious potential side effect of the drug is. The social worker should mention the risk of
A.
excessive weight gain,
B.
significant hair loss,
C.
Stevens-Johnson syndrome, SJS,
D.
hypertensive crisis. Answer: C. Stevens-Johnson syndrome, SJS. This question tests knowledge of a rare but life-threatening side effect unique to specific anticonvulsants, with lamotrigine Lamictal, and most serious potential side effect as the key clues. Stevens-Johnson syndrome, SJS, is a severe systemic skin reaction that can be fatal and is a known, though rare, risk of lamotrigine, especially if the dose is increased too quickly. The social worker must educate the client to monitor for any sign of a rash and seek immediate medical attention if one appears, as this is the primary indicator of this critical reaction. Therefore, the social worker must associate lamotrigine with the need to monitor for and report the presence of a rash immediately. Question 22. A client with major depressive disorder reports to the social worker that the prescribing physician suggested switching from an SSRI to bupropion, Wellbutrin. The social worker understands that a key benefit of bupropion compared to SSRIs is its lower risk for
A.
weight loss,
B.
nausea,
C.
sexual side effects,
D.
suicidal ideation. Answer: C. Sexual side effects. This question assesses the social worker's knowledge of the differentiating side effect profiles of common antidepressants, with a clue being the contrast between SSRI and bupropion, Wellbutrin. Bupropion, which primarily acts on norepinephrine and dopamine, not serotonin, is a frequent choice for clients who find the sexual side effects of SSRIs, a common reason for non-adherence, intolerable. The social worker can reassure the client that switching to bupropion is often done specifically to mitigate or eliminate that particular side effect. The practical takeaway is to remember that bupropion is the antidepressant often utilized to bypass the common sexual side effects of the SSRI class. Question 23. A social worker is reviewing a client's medication list and sees that the client is taking quetiapine Seroquel. The social worker should recognize that this atypical antipsychotic is most commonly prescribed for
A.
ADHD and narcolepsy,
B.
major depressive disorder, especially treatment-resistant cases,
C.
acute anxiety attacks and insomnia,
D.
schizophrenia and bipolar disorder. Answer: D. Schizophrenia and bipolar disorder. This question tests the foundational knowledge of the primary clinical indications for a common atypical antipsychotic, with quetiapine Seroquel as the key medication. Quetiapine is approved by the FDA for treating the psychotic symptoms of schizophrenia and for managing the acute manic and depressive episodes associated with bipolar disorder. While it is sometimes used off-label at low doses for sleep, insomnia, its main purpose and dosage range are for managing serious mental illnesses. Always associate atypical antipsychotics like quetiapine with the treatment of psychosis or mood stabilization in bipolar disorder. Question 24. A client reports taking prazosin for the past several months, and the social worker notes a significant decrease in the client's self-reported nightmare frequency. Prazosin is a medication commonly used off-label to treat which specific symptom related to what disorder?
A.
Depression in major depressive disorder.
B.
Cognitive deficits in schizophrenia.
C.
Nightmares in post-traumatic stress disorder.
D.
Agitation in Alzheimer's disease. Answer: C. Nightmares in post-traumatic stress disorder. PTC. This question assesses knowledge of specialized, off-label psychiatric medications, specifically focusing on prazosin's role in treating a classic symptom of PTSD. Prazosin, a blood pressure medication, is often prescribed off-label to reduce the frequency and intensity of trauma-related nightmares and sleep disturbances in clients with post-traumatic stress disorder. The social worker's observation of the client's symptom improvement helps validate the treatment effectiveness and should be communicated to the prescriber. Here is a simple association. Prazosin is the primary drug used to silence the disturbing nighttime symptoms of PTSD. Question 25. A client with severe obsessive-compulsive disorder, OD, has been prescribed an SSRI at a higher than usual dose. The social worker understands this high-dose use is common because
A.
SSRIs are not effective for depression and must be boosted for OCD.
B.
OCD's symptoms typically require higher serotonin activity than major depressive disorder.
C.
The risk of serotonin syndrome is lower with high-dose SSRIs.
D.
The goal is to induce a minor level of sedation to control the rituals. Answer: B. OCD's symptoms typically require higher serotonin activity than major depressive disorder. This question tests the knowledge of disorder-specific dosing practices for medication with severe obsessive-compulsive disorder, OD, SSRI, and higher than usual dose as the key elements. OCD often requires a longer period and higher than standard antidepressant doses of SSRIs, like fluvoxamine or sertraline, to achieve a therapeutic effect in reducing obsessive thoughts and compulsive behaviors. The social worker should understand this dosing difference and normalize the higher dose regimen for the client and family as standard for this condition. The takeaway is to remember that OCD is often the exception to the rule, typically requiring maximized SSRI doses for symptom relief. Question 26. A social worker notices a client's chart indicates they have been prescribed trazodone. Based on current trends, the social worker should anticipate that the client is most likely taking this medication for
A.
treatment of chronic pain,
B.
severe psychosis,
C.
primary insomnia or sleep aid,
D.
bipolar mania. Answer: C. Primary insomnia or sleep aid. This question tests the awareness of trazodone's modern clinical use, which has shifted over time, with trazodone being the core concept. While trazodone is technically an antidepressant, it is most frequently prescribed today at low doses for its sedating side effect to treat chronic or primary insomnia. The social worker should know that in current practice, if a client is taking a low dose of trazodone, it is highly likely that it is being used specifically as a non-habit-forming sleep aid, not for its antidepressant properties. The best tip is to associate low-dose trazodone with a common prescription for sleep issues. Question 27. When a client expresses fear of addiction to a newly prescribed anxiolytic, the social worker should confirm the medication is a benzodiazepine if the client reports being prescribed
A.
buspirone Busper,
B.
venlafaxine Effexor,
C.
clonazepam Klonopin,
D.
Prazosin. Answer: C. Clonazepam Klonopin. This question tests the ability to correctly identify a common benzodiazepine from a list of various psychotropic drugs using the key concepts of fear of addiction and anxiolytic. Clonazepam Klonopin is a long-acting benzodiazepine known for its high potential for dependence and withdrawal, making the client's fear of addiction valid and requiring careful monitoring and management. The social worker must be able to distinguish this class from non-addictive alternatives like buspirone and other drugs to provide accurate psychoeducation. Remember the common benzodiazepines, often ending in PAM or LAM, as the class with the highest potential for physical dependence and addiction. Question 28. A client on an SSRI reports confusion, agitation, muscle twitching, and a rapid heart rate. The social worker recognizes these symptoms as a medical emergency potentially caused by an excess of serotonin, known as
A.
neuroleptic malignant syndrome, and
B.
serotonin syndrome,
C.
hypertensive crisis,
D.
anticholinergic toxicity. Answer: B. serotonin syndrome. This question is an assessment of a critical medication-related emergency using SSRI, confusion, agitation, muscle twitching, and excess of serotonin as the definitive clues. Serotonin syndrome is a potentially fatal condition caused by the excessive buildup of serotonin, usually due to a high dose of an SSRI or a dangerous drug interaction with another serotonergic agent. The social worker must immediately recognize this distinct symptom cluster as an emergency and advise the client to seek medical care immediately. A simple takeaway is to link muscle twitching and confusion with serotonin syndrome. It is a sign of too much serotonin activity. Question 29. A social worker conducting an initial assessment of a new client must prioritize asking about psychotropic medications to
A.
determine if the client has an actual mental illness diagnosis.
B.
Ensure the client is taking only natural, herbal supplements.
C.
Assess for potential side effects, drug interactions, and adherence patterns.
D.
Confirm the social worker has the authority to adjust the client's dosage. Answer: C. Assess for potential side effects, drug interactions, and adherence patterns. This question focuses on the essential role of the social worker in gathering medication information, with prioritize asking about psychotropic medications as the core theme. Social workers need to know what a client is taking, including dosage and frequency, because non-adherence, intolerable side effects, or drug interactions can directly affect the client's current mental status, mood, and engagement in therapy. For instance, a client's self-reported depressed mood might actually be a side effect of a medication. This information is vital for safety, treatment planning, and effective collaboration with the prescribing team. Question 30. A client with major depressive disorder is prescribed a medication that does not cause sexual dysfunction or weight gain, but carries a dose-dependent risk of seizures. The social worker recognizes the client is likely taking
A.
Escitalopram, Lexapro,
B.
Bupropion, Wellbutrin,
C.
olanzapine, Zyprexa, D. Lithium. Answer: B. Bupropion, Wellbutrin. This question tests the ability to identify a medication based on its unique profile of benefits and risks, with the clues being does not cause sexual dysfunction or weight gain, and risk of seizures. Bupropion, Wellbutrin, is the specific antidepressant known for this favorable side effect profile, but has a dose-dependent risk of lowering the seizure threshold, especially at high doses or in clients with pre-existing conditions like bulimia. This is a crucial piece of knowledge for social workers when discussing treatment options or risks with a client. The helpful takeaway is to link bupropion's lack of sexual side effects with its specific seizure risk. Question 31. A client reports taking an older antidepressant primarily at night because it causes significant drowsiness and grogginess. The social worker knows this sedating effect is a prominent side effect of
A.
stimulants,
B.
benzodiazepines,
C.
tricyclic antidepressants, TSAs,
D.
serotonin norepinephrine reuptake inhibitors, SNRIs. Answer: C. Tricyclic antidepressants, TSAs. This item tests the practical side effect recognition of older psychotropic drugs, with older antidepressant and significant drowsiness and grogginess as the key clues. Tricyclic antidepressants, TCAs, are known for their potent sedative effects due to their strong antihistamine properties, which often leads clients to take the full dose before bed. While some modern drugs can also be sedating, this pronounced effect is a hallmark of the older TCA class. The social worker should understand that this side effect is often why TCAs are sometimes used off-label to aid with insomnia. Question 32. A client has been prescribed an antipsychotic medication to manage the severe irritability and behavioral challenges associated with their autism spectrum disorder. Which medication is most likely to have been prescribed for this specific indication in children/adolescents?
A.
Alprazolam, Xanax.
B.
Risperidone, Risperdal.
C.
Lithium.
D.
Methylphenidate, Ritalin. Answer: B. Risperidone, Risperdal. This question tests knowledge of specialized FDA-approved uses for atypical antipsychotics beyond psychosis, with severe irritability and behavioral challenges, and autism spectrum disorder being the key indications. Risperidone Risperdal is one of the few medications specifically FDA-approved for managing severe aggression, deliberate self-injury, and temper tantrums in children and adolescents with autism spectrum disorder. The social worker should know this specific application to properly educate the client's family and monitor for side effects like weight gain or sedation. The best tip is to associate atypical antipsychotics like risperidone with the specific behavioral challenges of autism. Question 33. A social worker is educating a client who is non-adherent to their medication regimen, stating they are doing fine and don't need it. The social worker's best initial strategy is to
A.
terminate services until the client agrees to take all medication as prescribed.
B.
Educate the client about the illness and explore the client's specific reasons for non-adherence.
C.
Contact the prescriber immediately and recommend a mandatory injection.
D.
Focus entirely on psychotherapy and ignore the medication issue for the time being. Answer: B. Educate the client about the illness and explore the client's specific reasons for non-adherence. This is a best/next intervention question focusing on the social worker's collaborative approach to non-adherence, with the key being to address the client's perspective first. The best initial strategy is not punitive but collaborative, requiring the social worker to understand the client's specific barriers, which could include cost, side effects, stigma, or lack of insight, anosognosia. Effective psychoeducation about the illness and medication is the foundation for exploring these underlying reasons and building a therapeutic alliance around adherence. The social worker's role is to collaborate on solutions, starting with a non-judgmental exploration of the client's concerns. Question 34. A client who is being treated for a severe depressive episode is prescribed an SSRI and starts taking St. John's wort, an herbal supplement, without telling their doctor. The social worker should be most concerned about the increased risk of
A.
hypertensive crisis,
B.
serotonin syndrome,
C.
neuroleptic malignant syndrome, and
D.
tardive dyskinesia, T. Answer: B. Serotonin syndrome. This ethical safety item tests the social worker's knowledge of dangerous drug-herbal interactions with SSRI, St. John's wort, and without telling their doctor, being the critical clues. St. John's wort is an herbal remedy with significant serotonergic properties, meaning that when taken with an SSRI, it drastically increases serotonin levels and raises the risk of the potentially fatal serotonin syndrome. The social worker must immediately educate the client on this specific danger and advise them to stop the supplement and contact their prescriber immediately. The takeaway tip is that St. John's wort is the primary herbal supplement associated with a fatal interaction with SSRI antidepressants. Question 35. A social worker is conducting group psychoeducation for clients on atypical antipsychotics. The most critical component of the education regarding potential long-term health risks should focus on
A.
the need to avoid cured meats and aged cheeses,
B.
the increased risk of developing metabolic syndrome,
C.
the potential for irreversible movement disorders like tardive dyskinesia,
D.
the possibility of dangerous withdrawal symptoms. Answer: B. the increased risk of developing metabolic syndrome. This most critical question assesses the social worker's understanding of the primary, long-term health risk associated with the atypical antipsychotic class. While all options represent important risks, the most critical and widespread long-term risk of medications like olanzapine and risperidone is the increased risk of metabolic syndrome, leading to weight gain, high blood pressure, and type 2 diabetes. The social worker must emphasize monitoring weight, diet, exercise, and getting regular blood work to mitigate these significant cardiovascular risks. The social worker must ensure clients understand the long-term health monitoring necessary due to the high metabolic risks of this class of medication.